one of the incredibly successful treatments is, if it's appropriate, is a rewind on previous loss, previous trauma, previous treatment trauma. I've had some unbelievably good outcomes from that. It changes women's ability to be able to go on with treatment when they're not carrying all of the grief from previous losses and treatments. And for some women, that can be many.
Hello and welcome to another HD podcast. I'm Jo Baker and I'm part of the HD team. And today I'm going to be talking to Sarah Denning about supporting people through fertility treatment. Sarah is an HD therapist and qualified as a midwife in 2001 and as a birth trauma therapist in 2018 and has worked both in the NHS and private practice for the last 20 years. More recently, Sarah's career has taken her into fertility nursing in an IV clinic where she now works solely as an IVF counsellor. Fertility problems can be so distressing for anyone who wants a child. It comes as a complete shock, completely changing their perception of themselves and also of their imagined future selves as parents. Patients can really struggle with their emotions and a sense of loss, as well as the intense anxiety about the treatment process. Recognising the need for additional support, Sarah set up an emotional wellbeing clinic to complement the counselling service that they already had, where they provide patients with much needed support and guidance. Hi, Sarah. How are you?
Hi, I'm good, thanks, Jo.
Thank you so much for joining us today, and we're absolutely delighted to have you here and really explore the amazing work that you're doing. And I know that it's developed quite a lot since we last spoke. Perhaps you can start by telling us a little bit more about your experience and the role that you're in currently.
Yeah, my job now, having moved out of fertility nursing, is to help people explore their emotions. There's two arms to it, really. There's the supportive counselling for people that are struggling with anxiety, but there's also a huge need for people that are considering using donor sperm or donor eggs, donor embryos, or using a surrogate to have a child. It's called implications counselling, and that's to help them explore their feelings around what it will feel like to have a donor conception, and not only what it will feel like, but far into the future, what things might be like for that child and how they would explore those feelings with them, and what they might want to know. And it's a really big departure from the sort of expected pathway that they thought their life would go on for about using donor eggs or sperm or a surrogate for achieving a pregnancy, because we have an expectation that you grow up and it's not one in the forefront of your mind when you're young, but expecting that one day, if you feel like it, when you feel like it, that you will have a family just like people do, because that's what you've seen as you've been growing up. And then when that doesn't happen, first of all, you've got the shock of changing that pathway from that to needing IVF. And then further to that, some people have to make another adjustment, a huge adjustment, to not using their own eggs or their own sperm, or having to find someone else to carry a baby for them. There's a huge amount of sadness and anxiety and worry. And the anxiety, not only about how to have a child, how to achieve having a family, but there's also, for women, there's also the time element as well, is that they're very, very conscious that time is going on, and their fertility is declining.
So what sort of support is available for people who are experiencing fertility problems?
Well, there's quite a lot, actually. Every clinic should have a fertility counsellor who's available to give support. And I belong to the British Infertility Counselling Association, and that's something that you need to become an accredited member of, something I'm working towards at the moment, because that's a very specialist area, and it's looking at that. So there's it's called BICA. So there's BICA, and there should be a counsellor in every clinic, and every patient should have the availability of seeing a counsellor. And for people that are considering using donor gametes or surrogacy, it's very, very necessary that they have some time with the counsellor. So that should be available in every IVF clinic. And it doesn't have to, it's not mandatory that they have it, but it must be offered.
Okay. And is this something that, is this that do they need to pay extra for this, or is this just something that is...
That varies from clinic to clinic. Most clinics will have some sessions included with treatment. Some clinics will have unlimited access to the counsellor, and in some clinics you will have a set number of sessions that are available to you.
So in the work that you're doing, how do you help? How do you support the people that come to you?
Well, it's been really interesting. I mean, it's been a learning curve for me as well. And apart from the traditional sort of supportive counselling, talking about how they feel, the human givens element of it has been such a massive part of it for me, because it's helping. I think one of the biggest things that you can help people with going through IVF, because you can't say to them, I'm going to help you deal with this and then it's going to be fine, because you don't know if it's ever going to work. You don't know if they're ever going to have a child from it. So it's an ongoing situation, but reframing is a huge, that part of helping them to see what could be better and taking anything out of that. And building resilience actually is really, really important, is helping them to be resilient for ongoing treatment. But the human givens part of it that's really been astonishing, I think, in this treatment is when people have trauma from past treatments, from pregnancy losses. That's a really big part, actually, the pregnancy losses. And I don't know why, but some people seem to feel that there is a point at which it's okay to say you've suffered a pregnancy loss. But if you talk to anyone that's had IVF, they have their treatment and then they have to wait 2 weeks to find out if it's worked.
Right.
And in that 2 weeks, and actually all through their treatment, you know how fast the brain works. The brain can go through a lifetime in seconds. It's really, really quick. And in those 2 weeks, every day, and all through their treatment, every day, and all through the years before they had their treatment, they have lived a life for a child in their minds and themselves within that life as a parent. And it's the loss of that is the loss. If they get a negative test, or if they get a positive test and then 3 days later it goes negative, or if they get a positive test and then when they come back for a scan 2 or 3 weeks later, there's no heartbeat. That is real grief. And actually being able to explain to them and acknowledge that loss as a real loss can be very, very helpful to a lot of women and men as well, mothers and fathers. And sometimes it's the first time anyone's acknowledged that it is actually a loss and it's grief that they have.
And I think that's so important, that you're talking not just about the parent that is carrying the child, but also the other parent involved as well. So the support is there for both.
Yeah, it is. I mean, there are not enough men come forward for support. And, they have just as many emotions. They want to be fathers just as much as women want to be mothers. And it's acknowledging how they feel too that's really important. And they are beginning to come. I have seen a few fathers now who have carried all of their grief and not shown it to anybody because they felt they needed to be the strong one. But Jo, one of the incredibly successful treatments is, if it's appropriate, is a rewind on previous loss, previous trauma, previous treatment trauma. I've had some unbelievably good outcomes from that. It changes women's ability to be able to go on with treatment when they're not carrying all of the grief from previous losses and treatments. And for some women, that can be many.
And so you're able to work with them. How many sessions would you get? So you could do a rewind and then I guess a follow-up.
I have 2 sessions available to me.
Yeah, incredible, absolutely incredible. You talked about reframing people's experience, and as we know, when we're working with reframe, we've got to tread so carefully and be so sensitive with that. So just as a mum thinking about, having the experience of loss or of not being able to have a child, how can you reframe that?
It is hard, and you do feel like you're sifting through to try and find those points to reframe. But even if it's something really, really small, like how well someone has dealt with the treatment that they've had and the tenacity they've had in the face of failure to go back and try again, it's looking at the strength of character. Even if it's a very small thing, congratulating them, using congratulations and helping them to see how strong they have been coming up to that point. It's finding something that you can do that with can often actually have a really good effect. You can't change anything, and yes, you may be talking to a woman who's had 5 failed cycles or miscarriages, who is at rock bottom, but if you can find a tiny thing that gives them a little bit back, and makes them feel a little bit better about themselves.
And I guess I know you talked about, you shared with me a while back some feedback that you'd had from the lady that you'd worked with. And I guess the expectation around traditional counselling, if you like, was that, certainly in a session where we're talking about grief and we're talking about loss, you wouldn't expect to focus on anything positive, would you? And so maybe that's what's really setting these sessions apart, is that finding those positives and finding those things to hold on to.
Yeah, and I think a really important part of that is in the information gathering. Is finding out, what they do outside of IVF and what they're good at and their life achievements and things. And it's just making sure you get a really full picture, so that you can find something. And that's great to use in guided imagery, is to use those qualities that they have to help them to move forward with their treatment. Actually, I spoke to I had some feedback from a patient recently who'd had, goodness me, multiple cycles and failed outcomes and all sorts of really difficult things to deal with in her throughout her IVF treatment. And I saw her twice, and she wrote back to me and said that she'd got more from 2 sessions of human Gibbons therapy than in 4 years of therapy.
Wow.
She'd seen a therapist twice a week for 4 years, and she felt better after 2 sessions. And one of those was a rewind.
Rewind. Yeah.
Hard for her. She was so courageous to do that. But it really, really did help.
So it's the importance of that, we're looking at rigor, aren't we? So, the rapport that you build with your clients, the information that you gather and you understand. So really, listening and listening to what's not being said as well.
Really listening,
really accessing all of their resources as well, so that and an understanding, what is their goal, because their goal was originally to have a child, and that might have changed now.
I never asked them that question, because it seems like a very fatuous question to ask someone who's having IVF, so I never put it like that. I try and sort of introduce it when we're chatting as if you could feel better, or something like that, but I never use the word goal, because the goal.
And I think, that's the beauty of it, isn't it? That you've got the flexibility to, and I think probably not something that I use that often either, to be honest, the word goal, but just what, if everything, you may be using an example like the miracle question or something, what could that future look like? You have to be really careful of the words that you choose when you're trying to get the answer to, or find something that you could use to help them. Because I think the language of IVF treatment, there's a lot of words that are either trigger them, or they're words that just don't help them. They've heard the same things over and over again from everybody, sometimes well-meaning, sometimes thoughtless. Just relax, it will happen, you've got time, my friend did this and they got pregnant, and my friend's friend did such and such. And they've heard these things over and over and over again. There's a lot of sadness and a lot of anger
actually, when people keep telling them these things. It's a very niche sort of, it's more well known now, but IVF is something that you kind of, it's one of those things you don't really think about unless you have to engage with it. And so a lot of people don't know much about it, or they think it's just very successful. Oh, just have IVF, because they have heard more about it. And as far as they can tell, it just kind of works, doesn't it? In their opinion. And that's very difficult for them as well.
So something about, understanding and helping to manage people's expectations.
It's very hard to do that, actually. And quite a lot of patients don't want to share that with anyone. They don't tell anyone they're having IVF. It's very isolating. And we talk, my patients and I, about how isolating that feels, and how if you're constantly getting little needles, little tiny knives of comments, and it's just constantly, you go outside and there's masses of, you notice every single pregnant woman in the vicinity, and there are children everywhere. And because of the age group that you're in, your peer group, a lot of them have children already, one or maybe two, maybe more. And every time you go to a social event, everybody talks about their kids, right, all the time. And if it's somebody you don't know, and you've gone to a social event, because of the age that you are, they will say to you, "Got any kids?" Yeah, and it's just endless. And so sometimes they think to themselves, well, okay, well, we're going to be going to this thing, and do I want to? Can I be bothered? Can I cope today with all of those things happening to me again? And sometimes they'll decide, I'm just not going to go. And so their life becomes smaller and smaller and smaller, and lonely. And that affects, their emotional needs, really. It affects all sorts of.
Yeah, I was just going to say, we can go down the emotional needs audit, can't we, and pretty much tick.
I do that with them, actually. And we do a lot of psychoeducation, hugely important to help them understand how the brain works. And it's not them, that's actually their brain is working in a fairly healthy way. It's because of the situation they're in, but their emotional needs are really, really important. So we do talk about the lack of volition, the lack of control, the lack of privacy, because fertility should be something that is very private matter between you and, if you have one, your partner, and nobody else. And you've had to lay out on the table over and over and over again for healthcare professionals, for people like me, counsellors, and it's should be an intensely private event that's become a clinical situation. So there's lack of privacy, lack of volition, lack of connection with your social group.
Yes.
It changes. IVF patients talk to me a lot, a huge amount, about how their life has changed, down to what they eat. A lot of them are like, well, I'm not drinking anymore. I'm trying to stay really healthy. I'm taking supplements, and they're pouring through the internet to try and find, is there anything else I should be doing? Anything else? Is there any one thing that I could do? Because they blame themselves. If it doesn't work, they think, maybe I should have, maybe I should have, maybe I should have. What if I'd done this? What if I'd done that?
Yeah. Just so much there, isn't there? You talked as well about building resilience in your clients. What does that look like? How do you do that?
Well, the psychoeducation is a really important building block for that, is explaining why your brain, the relief when you explain to them how your emotional brain and your rational brain work or don't work together. It's like, that it's a real light bulb moment. And then when you've done that, and I use everybody, 7-11 breathing is giving coping tools, actually. And the aware technique, I use that a lot as well, because they're really solid, present things. And in a situation where you feel you have so little control, that's giving them something that gives them back some control and that understanding. So that builds resilience, I think. And we talk about all the triggers. We talk about what we were talking about just now, about all the times that you get bombarded with people asking you things. And sometimes somebody's due to go to an event, and they're really anxious about that. And I don't want to go because it's just going to be horrible and I'm going to get really upset. And we talk through that. And if it's something that they would quite like to go to, but they're a bit scared to go to, we talk through how they could manage comments like, got any kids? Or come on, when are you two going to get going? Or things like that. We talk about how would you like to respond to that? And what do you think, how do you think you could respond to that in a way that you can manage that situation so you have more control? And then we'll use that. I'll do a guided imagery and they'll go through going to that event using those terms and other tools that they can use. And that's really helpful as well on a day-to-day basis, not just for going to things, but at work. And
yeah, so they've got that mental rehearsal, haven't they, already, of making it much more likely that they're going to be able to draw on those tools, pull those tools out of their toolkit, if you like, when they need to use them in the life situations. Yeah, amazing. And so, you've talked about the aware technique for anxiety, and also about using rewind for de-traumatizing either previous rounds or loss, etc., and also the use of psychoeducation as well. And it really seems that you said that the human givens approach has just given you so much more to be able to work with when you're working with these clients. And as you're working with unknown outcomes, as you said, you've got to be so careful because you don't know what the outcome of somebody's journey is going to be. How do you work to build hope in situations like that?
That's a tricky one. It's a tricky one to build hope. But having treatment itself is building hope, because that treatment could work. And there is quite a lot of fear around doing it again, because they will have to cope with the potential further loss. And it's talking about, well, if you could choose not to have another treatment, you could choose that to protect yourself, or because you've just had enough, you could choose that. But then it won't work. Okay, then you won't work. And if you're having another treatment, there is hope. And we just talk about, it's basic things about, the statistics around, and they'll all have read the statistics around the success rates and things in different age groups. And sometimes with IVF, it is a matter of just the number of times that you try and your likelihood of success. Okay. So it's just around that, really. I mean, it's a hard one in IVF, hope, because hope is something they've had a lot of, and they don't dare allow themselves to have, because the fall is so deep and so long, and so it's such a fall from such a high place. If you allow the hope and then you get another negative, it's a long way to fall. And most of them will have been through that 2 or 3 times already, so they tightly control their hope. Yeah.
And if you're working with somebody, you said to me that you have different arms, if you like, of the work that you do. You talked about the implications, counselling, as well as the counselling for people who are using their own sperm and eggs. When you're working with somebody for whom the end of that journey has been reached, how do you work in that way? How do those conversations go?
Well, that's something that, I mean, as you know, is a really long process, because that is loss and that is really deep grief. And again, that's changing their feeling about who they are as a person and what they expected their life to go like. And that's an ongoing thing. And I don't have enough time to go through that with them. And people, men and women that I've talked to, are in a deep state of grief when they come to the end of that. And it's quite a difficult, I think we talk about grief and what grief is, and that again, there's this expectation sometimes that grief is allowed to last for so long, and it has to be something that other people can see as a visible thing, a physical loss of something, when the loss may just be of their hopes of being a parent. That's it, and it's a huge loss, but it's not visible to other people. And quite often they'll say, "Oh, I should be feeling better than this, and I should just pull myself together, and I should." They use the word "I should" a lot, and that's a discussion about grief, really. That grief doesn't have a beginning and an end, and it's a process. and it takes as long as it takes for the person that's going through it. But I do recommend that if I can't see them anymore, then they need to have more help than I have the time to give them.
Yeah, so that's what I was going to say. Is there ongoing support available for patients?
Well, yes and no. I recommend that they go on to grief counselling.
Yeah.
And their GP can generally refer them to that. But it's something that I would like to say. I think you definitely need more than 2 sessions for that. I mean, grief is a really big thing, and there may be points that people need help at this point, and then they're okay, and then they need a bit more help further on to process something else, and that's sort of out with my capabilities really within the clinic that I work in. It's a beginning point, really.
And I think just listening to you talk and using phrases that people just use every single day without even thinking, just being more aware, I guess, that we can't possibly know what journey people are on. And we just make so many assumptions, don't we? You know, you've been married for so long, or, you know, you've been together for so long, you know, when you're going to have children, etc. And, you know, actually it's not our business to ask that.
It's not.
Perhaps, you know, we could all do with thinking about, you know, being more aware that we can't possibly know what journey people are on. What sorts of things can families and friends do to help and support? And is there anything that we should just completely stay away from?
In terms of, to answer the first thing you talked about, is yes, if I could remove the phrase, have you got any kids, from anyone who ever meets one. It's a social opening gambit, you know, it's hi, you know, my name's talk for a bit. Oh, you've got any kids? You know, if people have got children, they'll be very quick to tell you, so you don't ever need to ask them. You know, they will always introduce that. And it would be great if everyone was aware of that. It's just don't ask anyone. It's not being rude, it's being thoughtful.
Yeah.
Just in case. They'll tell you if they have. They'll bring it into the conversation. My son, my daughter.
Yes.
Always. We all do it, don't we, all the time? But you don't need to ask that question. And friends and family, it's really important, that they understand, and it shouldn't be up to the person who's having IVF to have to tell everyone how to be around them. But it is difficult when you don't know anything about IVF and all the things that we use as, we think, quite helpful expressions. We think we're being supportive, like, oh, don't worry, or just relax, or, you know, it will happen. Those are things that are not helpful to say, because you don't know if it will happen. And, you know, nobody has ever responded to someone telling them to just relax by saying, I didn't know that was what I had to do. I'll do that now. But people don't know what else to say. It's a bit like when you have a bereavement in this country. We're so unused to it. It's a very uncomfortable area. And so people tend not to know what to say about it, or say something that they don't mean it to, but it kind of shuts the conversation down because they feel uncomfortable with it. So friends and family, what can they do? Learn, educate yourselves, have a look on forums, find out what people going through IVF would rather you didn't say. Acknowledge that it's really hard for them, but don't try and fix it. Don't try and offer a solution. Just saying, it's really awful. I'm so sorry you're going through that. That's good enough.
Yeah. I'm
so sorry. That's not giving a judgment or offering advice or anything else. Don't try and fix it. Sorry?
It's just being there. Just knowing that you're there if somebody does want to talk to you.
Yeah. It needs a much wider spreading of that message, actually, because there's a lot of people have IVF. A lot of, whether you're a single man, a single woman, or a couple, same sex or heterosexual, a lot of people have IVF now. And I'd love to disseminate that information more so that people are more aware of it. It's such a painful thing to go through. And it's not something that has an end, you know, unless you are, you know, until you have that child. It's a really intrusive, invasive, emotional, draining, financially, emotionally, in a relationship sense. It puts enormous stress on relationships as well. Using human givens is fantastic. infertility, invaluable, really, because if you think of the number of times that if you're having counselling, traditional counselling, that you have to talk over what's happened to you, and if all that's doing is reinforcing that pattern, it's making you live it again and over again. Sometimes that's the worst thing that you can do. I've had people come in dread to their counselling session, dreading that they're going to have to talk about it again. And when I tell them, you don't have to talk about it, you don't have to tell me what happened unless you want to. I want you to tell me how you felt about what happened to you.
Yeah.
And the relief.
I was going to say that must come as such a huge relief.
Huge relief. You can see it. You can see their shoulders relax. I say, it's okay. We don't need to talk about that. Yeah. Let's just tell me how you feel about it, and let's just find a way to make you feel better and make you feel more resilient to go forward. Let's do that. And they're just like, yes, please.
Yeah.
It's a real revelation for the patients. I mean, I can't tell you the number of comments that I've had back and feedback that I didn't know I could feel better like this. I've never had treatment like this before. I've been seeing somebody for ages, and how, it feels like a miracle. And I'd be very wary of using the word miracle, because it's not a miracle. It's based on, sound evidence.
Yes.
And I do say it's not a miracle. It's just helping your brain to work in a slightly different and better way for you, and allowing you to let go of all the things that have happened to you before, so you can move forward in a better place. It's heartbreaking.
And I guess that is the whole point, isn't it, of the work that you're doing? It's from wherever they are now, moving forwards into the future, as it will be.
Yeah. Whatever shape that may take.
Yeah. So if somebody was concerned about their own fertility, what advice would you give them?
If someone was concerned about their own fertility, is don't wait. I think all too often women come into the clinic and they've been trying to get pregnant for quite a while, or they thought, I'll do it a bit later, and kind of not thought about it because they don't want to, because their lives are so busy and they haven't had time to think about it. Or sadly, they feel, well, there's loads of treatment you can have now, so we'll just wait and then we'll just have IVF later. But age is really, really important factor with women, because egg quality and quantity declines. And if you're 35 and you're still thinking about it, you ought to go and get an assessment.
Right. So even if you're not ready to have a baby at that point, just beginning to start that process so the eggs can be harvested as early on as possible.
Yeah, egg freezing.
Yeah.
If you're at a stage in your life where it's absolutely not, you're just not in that place, don't think I'll be in that place in 2 years or 3 years' time. I'll do it then, because you might not be able to then.
That's really, really helpful advice. Thank you, Sarah. We've covered so much today, and I think there's so much more that we could talk about, but we're coming to the end of time now. Is there anything else that you'd like to add to what we've already talked about today?
No, I mean, I think one of the projects I've got on the go at the moment is to try and create some kind of resource for friends and family to be able to support someone going through IVF, so that it enables that person to feel supported within their own family, instead of feeling like they also have to cut themselves off from discussing IVF within their family because they're not sure of the reaction they're going to get. I would love to make some kind of video resource for friends and family, just to say this is how to be, and actually get some IVF patients on board in that video to say, this is how you help me.
Yes.
This is how you, please don't do this.
Yes.
Because I think that would be, to have that support and for people to know how to be around people that are having IVF would make make a little bit of that particular thing they're doing really, really much easier.
It'd be hugely helpful, because as I've had friends who've gone through IVF, and you want to say the right thing, you want to do the right thing, and sometimes you can end up doing nothing because you're too frightened of doing the wrong thing.
You do, and that also can have implications for how that person feels, because they can feel invisible then. It's like with a baby loss, if you've lost a child and that baby has died, people often don't talk about it because they're so scared of upsetting you, and you can feel like it hasn't happened. Like the rest of the world feels like it hasn't happened because nobody talks about it. And that's something that, you know, we need to learn a language of how to talk to people that have had baby pregnancy loss and are going through IVF, is to be supportive for them in that situation, but we need to learn the words.
Yes.
Mm.
Oh, that sounds like an amazing resource. And please do you keep in touch with us and let us know when that's available. We'd be really interested.
I will. And I'd also, just one last point, I think it would be, I'm working towards it, but I think disseminating the importance of the human givens approach in fertility counselling, it's really a big thing that needs to happen.
Yes.
And because I've seen from a personal point of view how massively helpful it is to men and women going through IVF. I mean, it is just huge.
So how are you working to get the word out there?
Well, I'm going to start with, I think we spoke earlier, I'm going to do a presentation to the doctors and nurses, the embryologists, the clinical staff in my hospital where I work, to explain to them what it is that I do. I think I said to you earlier, they think I go off into some little room and do some weird stuff. It has been described as weird stuff. So I would love to educate them. I want them to really understand how this helps. And then I think also going to the British Infertility Counselling Association, once I've got, you know, I'm going to have to collect lots of evidence and be able to show them some outcomes. It's got to be good stuff, but I would like to go to them as well and help them to see what human givens can do within fertility for men and women, because I think it's really important.
Fantastic. Absolutely brilliant work, Sarah. Such powerful stuff. Thank you so much for taking the time from your really busy schedule.
You're welcome.
And I'm sure the information that you've shared will help so many people, you know, either people who are listening who are on their own personal journey with it, or people who are supporting others on their journey and getting that word out there. So thank you so much.
Yeah.
Thank you to our listeners as well. If you've been affected by anything in today's episode, or if you would like to find out more, all the links and resources can be found in the podcast description. Until next time, goodbye.